Five on your health tonight. An NFL coach is putting heart health in the spotlight.
Chargers head coach Jim Harbaugh walked off the field yesterday in the middle of the game. He later told reporters he was having an atrial flutter flare-up. He received an IV treatment and an EKG from paramedics who cleared him to go back into the game.
We're joined now by Dr. Ali Raja, Deputy Chair of MGH's Emergency Medicine Department. Thank you for joining us, Dr. Raja.
Thanks, Jessica.
All right, Dr. Raja, what happens during an atrial flutter and how common is it?
Well, Ben, atrial flutter is what we call a cardiac arrhythmia. It's an abnormal heart rhythm. So usually the two parts of the heart, the two atria at the top and the two ventricles at the bottom, they're synced. And so they sort of beat in a coordinated one-to-one pattern. But in an atrial flutter, the atria start beating really quickly, sometimes up to 300 times a minute. And the ventricles beat only half of that, say 150 beats per minute, which is still really fast. It's not common at all, but it is more likely if you've got some underlying heart or lung disease, because that can predispose you to it.
You just mentioned it, but I want to give us more of a breakdown between, an atrial fibrillation and an atrial flutter. How do you spot the difference?
Well, Jessica, it's really hard without an EKG. The biggest difference is that, like I said, that atrial flutter is sort of coordinated. It may be 300 to 150, but it's somewhat coordinated. And atrial fibrillation is just a mess. There's no organized beating of the atria at all. And the EKG doesn't show any of those peaks when the atria are squeezing. So the two rhythms can be related because atrial flutter can sometimes lead to atrial fibrillation, but they look really different. And the only way to tell them apart is an EKG.
All right, so talk a little bit about the symptoms here. What will someone feel when they are susceptible to this, and how should they go about getting it examined and then treated?
Well, Ben, oftentimes the thing that brings patients into me if they have an atrial fibrillation or an atrial flutter is that they'll feel palpitations. They'll feel like their heart's beating either quickly or just sort of irregularly. And they'll either go to their primary care practitioner or come to the emergency department and they'll get an EKG, and that's how they're first diagnosed. Now, I have to tell you, a lot of times we can convert patients with atrial flutter or atrial fibrillation back to a normal rhythm with medication. And I don't know anything about Coach Harbaugh's situation, but if he went back to the field, they might have just done that. But if patients are really sick or unstable, sometimes they actually need what's called a cardioversion. It's kind of like what you see on TV where we put paddles on them and shock them. And that can actually convert them back to a normal rhythm a lot more quickly, but we only do that when patients are pretty sick. So if you feel that abnormal rhythm, that palpitation, definitely go get it checked out. It might be something that needs to get worked on.
Yeah, important to pay attention to those symptoms. Dr. Raja, always good to see you. Thank you so much for your insight.
Thanks, Jessica. Thanks, Ben.